portion. I'm Shonnessy Gilmore. I'm a certified industrial hygienist and certified safety professional with EHS-International. I have been very actively involved in the COVID-19 pandemic. My own personal history, I have a master's in public health in environmental and occupational health, which is anything in the workplace or the environment that could make someone sick. My focus was actually environmental microbiology. I worked with MRSA, which is a antibiotic-resistant skin bacteria, staph bacteria. After graduate school, I moved on into the construction industry, and I spent 8 years as a safety director, really focusing on environmental and biological and chemical concerns for workers. Did a lot of hazardous sites, HAZWOPER sites, but I also taught a lot of education on bloodborne pathogens and different biological microorganisms. So when the pandemic happened, I had a unique background, and we've been able to partner with Labor and Industries to offer this 6-part series. This specific webinar is going to be on people who work in more outdoor spaces. And since we have such a small group, we can really tailor it to you guys' experiences. I encourage people to ask questions, give me any situations. And as part of this, we can offer some limited CIH consulting. So my email will be at the end of this presentation. So please feel free to reach out to me, and I can offer some advice or point you in the right direction. We do have a webpage, and we'll be posting the recordings of these webinars to it. So that I'll show you where to find that as well. And we're also going to update it with blog entries and relevant things. So I'm really hoping we get people involved. Our upcoming webinars are going to be the next one, which is tentatively April 6th, is going to be focused on masks and respiratory protection. And it will go over how to build a respiratory protection program, which is required if your people are in an N95 or greater. And then we're going to talk about barriers, ventilation, HVAC systems. And as this goes on, we'll get to have some more unique discussions on the virus and where we are going to be. So very briefly, I'm going to cover what we know now versus a year ago when this was a novel pandemic. So we now know that it's what's called a systemic virus. That means it impacts multiple body systems. So it's not just your lungs like we originally thought. It's your lungs, your kidneys, your heart, your brain, blood vessels. We now know that it's primarily spread through airborne and droplet means. And fundamentally, the difference between those is the size of the particle and how long it lingers in the air. So airborne, which means an aerosol, these are very, very small particles, and they can be in the air for up to 3 hours. Droplets are larger particles that include saliva, and they typically fall to the ground within 30 minutes. Just talking can produce droplets that linger in the air between 8 and 14 minutes. And I think at this point, we all know how important masks are, but a study at the very beginning of the pandemic last March, they did a visualization using a fog machine and a mannequin to simulate coughing with different types of face coverings and no face covering. And the particles traveled 12 feet with no mask, but they were limited to 2.5 inches with a homemade cotton double layer mask. So very substantial difference in the travel. I want to go over some basics of the virus because understanding the microorganism really helps understand the vaccine, how we fight it, how we prevent the spread. So COVID-19 is actually the name of the disease caused by the coronavirus SARS-CoV-2. Coronaviruses are a family of viruses that have a spiky outer envelope that keeps all their genetic material safe and secure inside. This envelope is super important because if it's disrupted, if it's torn, the virus cannot infect your cells. And these spikes are super important because they're what bind to our cells and allow the genetic material to be transferred into our cells, and that's what causes infection. So we're going to talk a little bit about vaccines and how they work, and it's all based around those spike glycoprotein membranes. Is we teach our bodies to have an immune response to those spikes so they cannot bind to our cells and they cannot make us sick. And as we talk a little bit about variants, one of our concerns is that the virus will have enough time to mutate, that these spikes shift in a way that the vaccines don't work to recognize them, our body can't recognize them as well, and they're still able to bind. So understanding that essential structure of how these viruses work is really important for understanding how this disease is transmitted. And then coronaviruses, like I said, they're a family of viruses, and they include things like the common cold, and then also sudden or severe acute respiratory syndrome, which is SARS. And if you notice, the name of this is SARS-CoV-2. That's because it's SARS covariant coronavirus 2. It's 79% similar to the original SARS, and 50% similar to MERS, Middle East Respiratory Syndrome. This has been really important in vaccine development. When they talk about how quickly we've been able to get vaccines out, it's because we had almost 80% of the blueprint for the vaccines available from the last decade of research. So there's nothing really lucky about the pandemic, but at least we had that research and we were able to get highly effective vaccines out faster than anyone could have dreamed. So I'm going to take questions after this slide, but I'm going to go in once again to talking about aerosols and droplets. So in really technical speak, an aerosol is less than 5 microns in diameter, and then a droplet is more than 5 microns in diameter. For practical information, it's just how far they spread. They do know that both droplets and aerosols cause infection with COVID-19. They think droplets are more likely to spread it, are more infectious because they're bigger, they contain more virus, and they have our saliva to help keep that glycoprotein membrane wet, which keeps it infectious and keeps the virus active. The term fomite, it just means an object that helps spread disease through contact, like a doorknob or a light switch. If you guys remember last year, we were going nuts with the hand sanitizer and all of that. It's because we thought this was more like influenza, which does spread significantly through surfaces and contact. And we've found that fomites are really not a route of transmission for COVID-19. That's why you don't need to sanitize your groceries or things like that. Another really important thing to understand for any virus is the survival time. So COVID-19 has a half-life of 6 hours. That means if you were to cough out 100 virus particles, 50 of them would be unable to infect anybody, basically dead at 6 hours. At 12 hours, 75 of the original 100 would no longer be viable. So this means even if it is on surfaces, even if it's in a larger droplet, it really doesn't survive that long outside the host, which again is why surface transmission just isn't a worry anymore. Does anyone have any questions about these slides? And since we are such a small group, I definitely encourage people to ask as many questions as possible.
All right, so it looks like we have a couple questions, Shonnessy. So it looks like the first one is why the emphasis on fomites, parentheses, surfaces, in industries like construction?
I think it was, oh man, I don't want to speculate too much, but originally it was, how do we get people back to work as fast as possible? What can we control? And since they really didn't want it to be airborne, and I will say in the scientific community, there's a bit of tiffs about that aerosol versus droplet in are things really less than 5 microns? But in the practical public health thing, it doesn't matter. And it was airborne. So in the very beginning, it was, how do we get people back to work? What can we control? You know, it must be passed through by surfaces. If we sanitize everything, we can get people back to work. Now, there really shouldn't be that level of concern about sanitizing surfaces. Yes, that is the written requirement, that things be sanitized between use and as much as necessary for the day. And you can kind of keep that open to interpretation. I will say the sanitization helps with things like the flu or like MRSA and staph, especially construction sites. I always used to teach that staph and MRSA were a big part of construction. And so you get the added benefit from the sanitizing of things that actually are spread through fomites, but it's kind of a complicated answer. I also think people got a little bit of COVID burnout and haven't kept up as much on the new information. And that's why I do start with this on the talk, even though it might be a little boring for some, but it's really important to understand how a virus works if you want to fight it.
Great. That was a great answer. I hope that answered your question. If you have anything else, please feel free to send it in. So the second question is, am I considered a close contact to someone with COVID-19 if I was wearing a mask?
That's going to depend how long you were in contact with the person. Currently, the CDC definition of close contact is 15 minutes within 6 feet without a mask over the course of a 24-hour period. So, 1 minute without a mask each hour still would add up.
Great.
I'm going to go ahead and be a little more cautious and say it's going to depend some on your mask. If you're 8 hours in a really small room or like a car with someone and you're just wearing a bandana, I would definitely consider that a close contact, even if it's not quite the definition. If you're an N95, nope, you're good. So it's going to depend a little bit on the mask.
Awesome. Okay, that was all the questions we had.
Awesome. Thanks, guys. So this slide I have updated probably 6 times over the last 4 or 5 months, and it's always very sobering to do because the numbers increase astronomically. So we've had more than 500,000 deaths in the United States. Around the world, there have been 2.7 million deaths and 123 million cases around the world. And I will say, Washington, we are so lucky. We've had a really amazing response. We have 1/100th of the deaths and cases in Washington state compared to the rest of the country. We really did the right thing and we intervened early and we were able to really set the tone for the pandemic. And I do think we've had one of the best responses. I want to talk about mortality and morbidity. So mortality is the likelihood if you get a disease that you're going to die from it. So on average, 2% of the people who get infected with COVID-19 will pass away from it. It varies by country, so between 1.6 and 10.5%. And the reason it varies has to do with the average age in countries, the access to health care. A lot of external factors influence mortality rates. The other thing is now we have variants that are more infectious, are more resistant to vaccine, are more resistant to treatment. So we might see a shift in the mortality rate, even as less people are getting sick with COVID-19, people might get sicker from the specific variant they're getting. And then morbidity is the degree of a disease impacting your overall health. So you get COVID-19, you don't die, but you have asthma. That asthma shortens your lifespan in some way, lowers your overall quality of life. That is a morbidity associated with COVID-19. And we just don't know. There's definitely been people who've had strokes after COVID-19. There have been some mental health impacts after COVID-19 infection. So we don't know yet what morbidity is going to look like with this disease. So as far as symptoms, I'm not going to spend a lot of time on this because everybody knows the symptoms. But in general, if you're going to have symptomatic COVID-19, it's going to have a fever, cough, or shortness of breath. And the majority of people who have symptoms have all three of those symptoms. About 40% of infections now are asymptomatic, which means they have no symptoms, or they also include people who just lose their sense of taste or smell as asymptomatic. I would consider that a symptom, but it's how it's classified. But the people who are asymptomatic or pre-symptomatic, which means they're going to develop symptoms, but they don't have them yet, they spread the infection just the same as people who are symptomatic. And in a lot of cases, the spread has been driven by asymptomatic people because they don't feel bad, they don't know they're sick, they don't change their lifestyle. COVID has an R naught value, and that's how you say the R0, of 3. And it, just like the mortality, morbidity, it has a range of 0.5 to 6. And this means for every one person who gets COVID-19, they will spread the disease onto 3 people if they're not vaccinated, if they don't isolate, all of that. So with no other interventions, this disease spreads at a rate of 3 for every one person infected. So going back again to what defines contact, dose makes the poison is this really big concept we learn about in public health school, and it relates to anything. Anything in too high of amount could cause harm, and you can relate that back to microorganisms, viruses, based on how long are you around people that are sick, what protections do you have in place, are you wearing masks, are you inside, are you outside? So how long and how close are you to a sick person? Do we have any questions on those slides before we talk about the vaccines?
Yes, we do. So it looks like, okay. So the first one is, why do we wash our hands if COVID-19 is an airborne virus?
So that kind of goes back into the original understanding when we did think this was a contact and fomite driven virus. There is the possibility of inoculating your mucous membranes, your eyes or nose by touching a highly contaminated surface and then touching your face. In general, washing your hands is a really good thing. Like I said, prevents those skin infections, prevents the flu, prevents a lot of nasty stomach bugs. So you definitely don't need to be like bathing in hand sanitizer every time you go out, but having good hand hygiene is just an important thing in general.
Great. Okay, the next question is, should people who wear contact lenses take special precautions to prevent COVID-19?
So I would assume any precautions you're normally taking to put in contact lenses. You always want to wash your hands before putting in or taking out your lenses. Most industries where you're going to be in any level of close contact require either a face shield or glasses or goggles. So I would think anybody wearing contacts would be protected by that. So just keep up with the normal hygiene you'd use.
Sounds good. And that was it for that. Thank you.
All right, so we have 3 vaccines currently out. We're waiting on AstraZeneca, which will probably be approved in the next month or so. We have Pfizer and Moderna, which have been in distribution for a few months now. The pros to them is they're up to 95% effective. They're now finding that even one dose can be about 80% effective. The current protocol is 2 doses, either 3 weeks to a month apart, depending on which one you get. You usually have an immune response immediately after vaccination. It's more associated with the second shot, headache, fatigue, fever. Some people just have a sore arm, but all of those immune responses, they do just show that it's working. They are both mRNA vaccines, which very, very high potency. To give you guys a comparison, each year when we do the flu vaccine, we hope for something that's between 55 and 60% effective. So to have a 95% effective vaccine is really just miraculous. They're relatively low cost to produce. You can make them extremely quickly, which is great news. As we have variants that end up being resistant to vaccines, it'll only take a couple months to tweak the vaccines to make them effective for those variants for the most part. The downside, they have to be stored and transported extremely cold. They have to be used really quickly within opening them. And I just want to confirm and drive home, they don't contain any actual SARS-CoV-2. They are just using messenger RNA to teach your body to focus an immune response when they recognize those spike proteins on the outside of the virus. The Johnson & Johnson, I don't want people to poo-poo it for being 66% effective, because it's still about 80% effective at preventing severe illness. So when they say it's 66% effective at preventing laboratory confirmed COVID-19, that means someone could maybe have COVID-19 infection, but they have no symptoms. So either way, that is a huge bonus. Very strongly encourage people to get whatever shots available to them. There might be some special cases related to allergies or age or things like that that you can discuss with your doctor. Big benefit of the Johnson & Johnson is it just needs normal storage and it's single dose. So this is really going to be great for reaching places that just don't have access to those hyper cold freezers, and the average person doesn't necessarily have the ability to go and get 2 different shots. This is a viral vector vaccine. So it uses a completely harmless virus to train your body on how to react again to that spike glycoprotein. So to give you an idea on mRNA vaccines that have shown promise, influenza, Zika, rabies, and cancer vaccines. And I do know that the developers of the Pfizer vaccine are really going to shift their attention to working on cancer vaccines using this technology after we are through this pandemic. And then viral vector vaccines like Johnson & Johnson, that's what has been used for the last 4 years for the Ebola virus. And this is a lot on vaccines. I know there's a lot of questions about vaccines, so if anybody has anything, please feel free to ask.
So it looks like we have a couple questions about the vaccine. So the first one is, should we still wear masks after getting the vaccine?
Yes, and I will answer that with the next slide.
Perfect. And then the second one is, do we know how often we will have to take the vaccine yet?
That one we don't. It is possible we'll need boosters. It's really all going to depend on the next several months on how all the countries in the world are as far as getting vaccine to their people. The longer a virus spreads through a population, the more chance it has to have those mutations. And if it's able to mutate enough that our vaccines don't work on it anymore, then most likely we would need a booster shot. And that could be, one shot next year, or it could be a virus can become endemic, which means it's always present at some level in a population. That's the flu is an endemic virus. And so should that become the case with COVID-19, we would probably need an annual COVID shot, basically. So it's all really going to depend on the next several months all around the world. Hard to have an answer for that, but fantastic question.
Great. That was it for this section. Thank you.
So getting the vaccine, right now we're in phase 1, tier B2, I believe is how it's said. We have a lot of really complicated names, and I'm going to show you guys the actual website for that. So we'll talk really briefly about using the phase finder to determine your eligibility. Construction actually is not in the current phase. They're doing high-risk work jobs at the moment and high-risk populations over a certain age. But construction, because the majority of the work is outdoors, is safer than certain situations like agriculture, where they might be indoors processing or living in a community setting. Really, really good news on the vaccine front. As of yesterday, I believe, or 2 days ago, almost 25% of the US population has had at least one dose. Over 25% of Washington have had at least one dose. So if we can keep up with this schedule and meet the goal of every adult vaccinated that wants it by the end of May, I think that's going to be huge for reducing the possibility of those variants. So this gets into the mask question and herd immunity. So you've probably heard the term herd immunity in the last year, and it refers to either natural herd immunity or unnatural caused by a vaccine. And herd immunity is when enough people in the population have had a disease that it no longer spreads freely. Basically, the people that interact with each other are resistant either through a vaccine or antibodies. We can't go for natural herd immunity with this virus because we just don't know how long the antibodies last in people. We're pretty sure they last about 3 months, maybe 6 months, but we don't think you have lifetime immunity from getting sick. So we have to rely on vaccines for this. The World Health Organization estimates that we need to have 65 to 70% of the population vaccinated. I agree with Dr. Fauci, and I felt this way since the beginning, since it does mutate, since it does have the possibility of all these variants of people, if it does spread through a population, 80 to 85% to me is a much more reasonable number to prevent the spread. Especially as these variants that are more infectious and able to get around standard masking and standard distancing gain a foothold in the population. You do have to wear a mask until herd immunity is achieved. They did just update CDC guidances for fully vaccinated people in single household settings. So like a grandparent visiting their grandchildren, they can, if they're fully immune and no one's high risk, they're allowed to be without a mask. But for public places still, masks are going to be the way things go until we reach that level. And As to when we can stop wearing masks, I just talked to a friend about it. It's going to depend so much on those variants. I could see it not being an issue by the 4th of July, or I could see it being something we do until next year based off of the variants. So it's another thing that's hard to predict at the moment. I'm going to do a real quick share of the phase finder document and the vaccine information page. So if anybody has any questions on these, go ahead and think of them. So this is the Department of Health COVID-19 vaccine page. It's linked in this presentation, and we will be updating the blog soon with a list of all these resources, so you can kind of do a one-click. So it says who's currently eligible, which, like I said, are those high-risk critical workers in agriculture, fishing, food processing, groceries, people over 16 who are pregnant or have a disability. And I will define a disability in this sense is someone maybe who's deaf and can't read lips when people are wearing a mask. It's not a comorbidity, which would be things like asthma or other kind of immune things. So a disability is different than a comorbidity. And then if you want to find out when you're eligible, just click on the vaccine phase finder, go through the questions, give them your email. And if you're eligible now, it'll give you something to print off to show at your appointment. And you can go to the vaccine locator for that. And if you're not eligible, they will send you an email once you become eligible. So I'm going to go back to the PowerPoint. Do we have any questions on vaccines, herd immunity, anything like that?
We have a question about the phases. If you would like to answer that now or wait a little bit later.
We can answer it as best as I can. They've definitely changed almost weekly. So
yeah, sure. Okay. So it says March 31st, we will open up to phase 1B, tier 3 and 4. How will this impact regulations specific to construction job site requirements?
Well, my understanding is phase 1B, tier 3 is people over 16 with 2 or more comorbidities. I don't see that impacting construction. They probably moved up the construction eligible phase, but let me see if I can go back to that vaccine information with the phases. If they want to maybe clarify their question, I don't picture this really changing too much for construction. Based on my understanding on the vaccine right now, they're definitely going to wait until everyone is fully vaccinated and they get kind of a handle on where we're at with variants before they change any of the construction regulations.
Okay.
But if the person wants to reach out to me by email too, I can spend more time looking it up later. This is just a quick PSA for WA Notify. It's a free app that works on Apple or Android. It's completely anonymous, sends little bits of code around, and basically, if you were to get COVID-19, you would get a code from your healthcare provider to type into the app, and it will basically notify you if anyone you were in close contact with in the last week or two got COVID-19, but it won't tell you who, it won't tell you where or when. It'll just let you assess your risk on whether you need to self-isolate or get tested based on those. So definitely recommend anybody who has to work in person or has any sort of activities that keep them out interacting with people to download this app. It only works if you have it before you get sick. And like I said, completely anonymous, very secure. It's been used in a lot of similar technology has been used in a lot of countries since the beginning of the pandemic, and it can really be helpful to contact tracers. Okay, we're now going to get kind of into the nitty gritty of the workplace requirements. Do we have any questions about kind of the intro and basics before we go on?
No questions for now.
Perfect. All right, so this presentation's, I'm going to definitely lean it towards construction because that's the majority of our audience right now, but it's meant to apply for anybody who works mainly outside. So that's your landscapers, even zoos, things like that, agriculture. Every business right now in Washington is required to have a phase-specific COVID work plan. The basics of it includes how you're going to train your people, what signage you're going to use, how you're going to do ongoing education, and it needs to be in a language workers can understand. It's going to say who your supervisors are and how you're going to perform health checks. I think anybody who's been on a construction site in the last year knows about the COVID-19 checkpoint where your temperature is taken, you go through a list of symptoms before you're allowed to enter. It's going to cover what your mask requirements are. You might need to have greater PPE depending on how exposed and how close contact you're going to be in. You also might have greater PPE already. Like if you're a construction job site and you're working around silica, you're already going to have a respiratory protection program and you're already going to have people in respirators unrelated to COVID-19. There has been a shortage, obviously, of N95s, but there haven't been any major shortages of half-face filtering respirators or full-face filtering respirators. So there is no waiving of those requirements, the fit test, the medical clearance, the respirator program for your other work, your lead, your silica, your asbestos, things like that, that require a respirator. It's going to go over hygiene and sanitation. And like I said, the emphasis has really shifted as we understand more about how the disease works, but it is still currently a written guideline. So as frequently as needed, and especially shared spaces or equipment, it's going to go over what PPE is required for the work. It's going to say that you need to have a minimum of 6 feet social distancing, and going to say how you're going to teach your workers that, you know, are you going to have signage? Are you going to mark out the floor? What sort of engineering and ventilation controls you're going to use? It's going to want a response plan for if you do have a worker get sick, either before they come into work or once they're on a job site. And there's special requirements for different industries. I'm going to go on to the next slide, and then I'm going to take you guys to the resources I listed below. So outdoor industry guidelines. Some were just updated in the last couple of days for phase 3. Construction, luckily, it stayed completely the same for phase 2. Like I said, it is a lower risk industry because a lot is done outdoors. You might have special circumstances where you do have workers working inside a nearly completed building, and that has a greater amount of risk. But I'm going to take you guys to the page, and kind of talk about how to use that if you don't have a company plan or you want to update your company plan. All right, Samaya, can you confirm that it's the Governor Jay Inslee page that's showing on the shared screen?
Yes, it is.
Perfect. All right, so this page is the most important thing you can go to as a business person. It's the reopening guidance, and it gives the blueprints and rules, and they are updated prior to each phase, and they will say when they were last updated. So since we are construction for the most part on today's, I'm going to go to the construction industry requirements. So the vast majority of work designations have a specific requirement that you can use as a blueprint for your company. There's some, like the environmental field services, you have to figure out what most applies to your work, which, like I said, is typically construction. And then design your plan based around that. So construction, like I said, it's more or less stayed identical to the phase 2 plan because of the risk and what they understand about risk in outdoor workspaces. So this plan you can use to create your company program if you don't have one already. You basically go through the 26 requirements of this plan, which starts with the site supervisor, outlines the safety training, the social distancing. Like I said, how are you going to make sure that social distancing is maintained, PPE, the sanitation, and like we said, these rules for sanitation were established last April, I believe. So we know a lot more, but as long as these are the written requirements, you need to at least make sure your company's meeting the bare minimum requirements that are there. And we'll talk more about the JHA that is required for construction work in the presentation, but the JHA would be for any high or medium risk. Basically, if you have people working in a confined space or a smaller room together and they can't social distance, what are you going to do? You know, are you going to up their respiratory protection? Are you going to eliminate the requirement entirely and just have one person working in the space each time, add a face shield, things like that? So it just gives you a blueprint to follow if people can't maintain the distancing or if they're in a higher risk situation. Like I've said, outdoor spaces are significantly safer than indoor spaces. Less than 10% of reported SARS-CoV-2 infections have occurred outdoors based on a study that reviewed, oh gosh, I can't remember, I think 30 or 50 different other studies on transmission. They compiled the information and they found that less than 10% of the cases were from outdoor transmission. And then the odds of indoor transmission are 18 times higher in comparison to outdoor transmission. So that's why construction was able to start so much earlier than other industries. But you definitely do need to make sure you're conscious if you're doing finish work, things like that, where you're indoors, on what the airflow is like. Can you open windows? Can you vent out more? And then in general, when people do get sick outdoors, it's associated with people lingering in closed space, not wearing masks, or going inside during an outdoor gathering. You know, you're having a picnic at your house and someone comes into your house without a mask to help you put away the dishes type of thing, clean up. So it's when people let down their guard outdoors, typically, that infections happen. Do we have any questions on these topics?
No questions for these topics.
All right. So this is just kind of a scary slide on enforcement. Labor and Industries fined a farm more than 2 million after 2 workers died from COVID-19. They had a lot of violations, and it was one of the largest workplace health and safety fines in Washington state history. They basically weren't having their workers isolate, wear protective gear. They weren't keeping their workers in smaller groups to minimize, the cross-contamination between groups. And this series is in partnership with L&I, and they do want to emphasize they are not looking to be enforcers. They want to be educators and reach out, but enforcement is a real thing. The United States OSHA just released their enforcement program, their special emphasis program for COVID-19, and states are going to have 60 days to adopt the standard for the emphasis and requirements for that. Washington should be just fine. What we currently do meets those standards, but it means there'll be more OSHA inspections of these special emphasis programs, which include construction and agriculture, and basically all the industries where they've been seeing, people who have to work in person, they cannot work from home in these industries, and people who show the greatest risk. So that's something to keep in mind. If your company is missing any paperwork regarding their OSHA or their COVID-19 safety plans, please, reach out to me. I'll help get you hooked up with these websites, with the governor's website, to get you outlined for your company and get all of that in place in the next month or so. I'm going to go through some basic aspects of these plans. Some of it's going to be very basic. So if you have a question or an experience that you want to share on this, go ahead. Like I said, these were created as an intro to some more detailed topics that these webinars will go into later. So construction requires a job site supervisor. So you have to have a trained COVID-19 supervisor on your job site, and it's their responsibility to make sure that all of your workers are following your COVID-19 plan. And then, as I mentioned before, you have to have a job hazard analysis for medium and high risk work, which is pretty much any work that's within 6 feet. And like I talked about before, construction, we mostly think outdoors. That's why construction was able to proceed. But when you have workers indoors, you really need to pay attention to spacing and ventilation and limiting the number of people in a space. So the COVID site supervisor, each contractor at every construction job site, so you could have potentially 6 or 8 supervisors on one site, is designated by their company, and they're always present during construction, with the exception of single-family residential job sites that have less than 6 people on site. You need to display their name on all required COVID-19 job site postings. These postings, you can get example business posting packets on the website that I took you to before. The Associated General Contractors of Washington, though, the AGC of they have made free COVID-19 resources, and they are on the governor's board that helps decide all of the regulations for construction work. So going to their site, you're going to get sample plans, signage, sample JHAs, even recorded training for your people. So I definitely recommend going to the AGC website and checking them out. even if you think you have everything you need for your company, it's worth going and taking a look around to see what they've updated. So in general, it's their job to monitor employee health, enforce the site COVID plan, and then their name must be posted and included in your program. So training, you must do initial training on the first day of the job, and then once a week following. It can be a toolbox talk, it can be very brief. You have to maintain social distancing during these trainings. It needs to be, again, in a language they can understand. One trainer signs in all the attendees. That hasn't changed, even though, like I said, fomites aren't as much of a concern anymore. So the training, the biggest things I think for people are that it needs to be weekly for the duration of the pandemic until we're told otherwise by the governor. You need to have some form of COVID-19 training each week. Social distancing. So again, that at least 6 foot of distancing is maintained. I don't know if it'll be reduced. The CDC just announced that they found 3 feet of distancing was adequate for schools. At the moment, Washington doesn't have any plans to reduce social distancing. So all the work sites need to maintain at least 6 feet of distancing. And then in construction, if you are working within 6 feet, you must have a job hazard analysis and additional precautions like a higher level of respiratory protection for that work within 6 feet. No gatherings. Try and have your people take lunch and breaks and shifts. If you have multiple contractors on a job site at the same time, have them work in different phases, different times of day, whatever you can to minimize the number of people that are in each other's space. Controlling choke points in high-risk areas. It might be that you have like a one-way hallway, depending on the layout, or a sign on a door that says, you know, stop, open this slowly. There, you know, people coming out. Just make sure you're not having people congregate a bunch. And then as far as deliveries, try and do as much contactless delivery to construction sites as possible. You know, have signage that your delivery drivers can follow for delivering supplies and things like that. And just plan ahead. So PPE is still required, just like any other construction or agriculture. The employer is required to provide all necessary extra PPE. So that would be your masks, eye coverings, goggles, glasses, whatever is required by your industry and the risk level the company must provide. And then if the company cannot provide the appropriate PPE, the site must be shut down until you have it on hand. Do we have any questions on where we're started out before we go into sanitation?
No questions yet.
All right. So like I said, these standards were written a year ago on sanitation and cleanliness, but they are still the rules, and they must still be followed until they do any level of lightening up on that. But on the good side, I know we're seeing a lot less flu and stomach viruses and things like that. So hand washing stations that have actual soap and water are required. You cannot replace this with just hand sanitizer, but you can use it in addition to soap and water. I know a lot of people kind of jury-rigged some neat little outdoor sinks. I've personally run an event where I just did one of those igloo coolers that you use for kids' sporting events with warm water and hand soap, and just turn it on and use it that way. Encourage people to wash their hands regularly before and after they eat, before and after using the restroom, after touching their face. Post these practices around the work area. The CDC, Washington State, and the EGC all have great pre-made posters have disinfectants available, especially for high touch surfaces and shared tools between each user. And then at the moment, if you cannot maintain that level of cleanliness, the work cannot continue. And then if you have a sick employee or a suspected COVID case where a worker is going home, close off the area using barricades and signs. I will say, when it says immediately disinfect any area, knowing what we know about how long the virus can stay airborne, I would rather see people close off the space for a couple hours and just make sure nobody can enter it before they do any sort of cleaning up of the space, because the risk is possible that the air, if it's a space that doesn't have a lot of good airflow, could still have droplets or aerosols lingering. Again, this is a virus that symptoms don't necessarily mean that much, since only about a third of people who have the disease have symptoms anymore. But do train your people to stay home when they're sick. I used to be able to track the flu from job site to job site based on where my operators went, because construction workers are tough and they go to work when they're sick, and then they get everybody else sick. And I do think that's one of the best possible things that's coming out of this pandemic, is we're training people to stay home when they need to. So if you or your family member is sick, stay home. The touchless thermometers, like I said, I think everybody who's been to a construction site this last year is used to that. You can also train your employees to take their temperature at home if you don't want to do the screening at the entrance. And the definition of a fever is 100.4 or higher. But if someone feels really bad and they have a 99.9 degree temperature and other symptoms, definitely encourage them to stay home. You don't want to get so stuck on a certain criteria that someone develops a fever later in the day. They just weren't at that level of sickness at that point. And then the screening should cover fever, cough, muscle aches, shortness of breath, and new loss of sense of taste or smell. So encourage your people, if they get sick during the day, to report it immediately, preferably over phone or radio. And then they leave immediately. They don't need to get any special permission or fill out any forms. They just go. Anybody who's refusing to wear a mask, take a temperature, needs to be sent home. There are special ADA things for certain high-risk individuals or people who medically cannot wear a mask, but that's a different situation. And the resources are available on the governor's page for that, for planning if you do have a worker who meets those special requirements. And then this is a bear. They just kind of changed the quarantining requirements again. So this is the workplace regulation. It's different than the travel regulation they just updated. So as far as workplaces go, if you're exposed to somebody with a confirmed case of COVID-19, you need to quarantine for 14 days, or you can provide a negative COVID test result no sooner than 7 days from your last exposure. And if you can't quarantine for 14 full days, you can quarantine for 10 days without testing, as long as you don't develop any symptoms. And then just to cover it, the travel advisory is still that you don't travel, but if you do travel, get a COVID test 2 to 3 days before you go, get a COVID test upon return between 3 and 5 days. And then if that's negative, you can return to work at 7 days. If you don't do the testing for voluntary travel, you need to quarantine at least 10 days from when you returned. And then If an employee is confirmed to have COVID-19, anyone who they might have come in close contact with will be notified without violating the sick person's confidentiality as per the ADA. So that means you cannot send an email saying Joe Smith has COVID. Anybody who worked with him, go home for 2 weeks. You need to figure out by talking to the sick individual, have your HR or your qualified trained people or the state contract tracers figure out who they might have come into exposure with. You should be keeping records of your sites and where people are working, so you should be able to figure it out. And obviously there's definitely going to be situations where people, you only work with one person all the time and you're notified that you were possibly exposed to COVID-19, you might figure out who it was. But wherever possible, you're really trying to maintain the person's confidentiality. You don't want people to feel like they're an outcast for saying that they're sick. And this, again, with construction can be quite the thing. People don't want to admit they're sick. They don't want to be punished for being sick. They don't want to lose a good work assignment. So make sure you have the type of environment that encourages people to say if they're feeling under the weather. Any questions related to health screening?
Yes, there was one question. How does contact tracing work?
So there are state contact tracers, and I know they don't have as many contact tracers as they would like to. And basically, it's similar to that app I told you about. The medical office would notify the contact tracers at the state, and they would reach out and call the sick individual and kind of figure out what their activities and patterns had been for the last 2 weeks. Interestingly enough, the majority of people who get COVID-19 have no idea where they picked it up from. So that's why I really do encourage people to use that app. So they reach out to that person, they figure out who that person's come into close contact with, and they get the contact information for the people. And they're only going to reach out just for time to people who have a substantial risk of developing COVID-19 from the exposure. And they will reach out and inform those individuals that they were in close contact with somebody with COVID-19. And basically, they'll give recommendations based off of the exposure level. It could just be aware, monitor for symptoms, but you're still okay to go to work. Or it could be, you spent 30 hours with the person not wearing a mask in a car and you shared a hotel room for work, which you should not be doing right now, but I know things happen. So yeah, contact tracing is done by trained individuals that do respect those ADA requirements. And then I do know there's just not as many contact tracers as they'd like. So again, I really encourage people to use that app because that could potentially be the only notification you get if you are exposed not through a work situation.
Great, and that was it for that.
All right, and the JHA, I had thought about going through and making a JHA on this call. We can certainly do it during the live Q&A at the end if people feel like that's of value. But again, you just would outline what is the task that you're going to do that's going to be within 6 feet. Maybe 2 people are working within a trench box. And then you would go into the hazards of the work. And this just has to be about the hazards related to COVID-19. You would have a different JHA for the hazards, or you could combine them all into one of the hazards associated with being in a trench box. You need confined space training, you need trenching and shoring training, different levels of training depending on the situation. So you might have your workers in N95s while they're working next to each other, or this is construction, so you might have a half-face HEPA respirator. So you would outline what the risk of getting sick is, why you're doing the task. You know, there's no other way to do it. It's a two-man job. And then what you're doing, which in this case would be adding extra respiratory protection. And so the extra precautions, like I said, for this, it makes sense to just either wear an N95 or higher. But if it's maybe a fixed space, you know, it's the job office for a company, and you have two people that pretty much are inside the job office all day long, and it's just a big shared trailer, maybe throw in a divider. So each kind of has their own private office, so they're not breathing each other's air. So you just have to plan based around the different circumstances. And before we go into the question and answers, and hopefully hearing some situations and experiences for people out in the field, I want to talk a little bit about COVID-19 and mental health. So we're more than a year into this. I'm sure anybody who has Facebook has spent the last 2 weeks getting memories of all the things that changed. I know a year ago was when our offices were packing up to become primarily remote, which obviously these outdoor workspaces, construction, agriculture, most of them weren't becoming remote, but a lot of people, you know, they were home, we were shut down, we were locked down. And then when people returned to work, it was very different. You know, wearing a mask can be very stressful. I do want to stress that I think they're one of the #1 ways of preventing the spread of COVID-19, but they're not fun, they're not comfortable. Working all day in a mask, it's an extra layer of stress and difficulty, and there's a lot of mental fatigue. So I think it's very normal for workers to feel burnout right now. And we're at kind of a unique point where we're feeling a lot more hopeful with the vaccines coming out, but we also have the variants. And like I said, things are a little up in the air. Might be significantly better in just a few months, or we might be looking at another year of this, depending on how things work out. So Washington has a free call-in line just for COVID-19 stress and mental health called Washington Listens, and it's available at the number below. Your company might also offer an employee assistance program or other options, but I would really encourage people as company providers or as their safety leadership to reach out and try and understand the unique situation. You know, children have been home, or now that kids are returning to school, there might be a lot of nerves connected to that. So just try and be really understanding and focus on taking as much good as can be done from this. Like I said, people not going to work when they're really sick. And, you know, some of the ways we've managed to become far more connected, you know, Zoom with family and friends on the other coast, you know, you might be seeing some people more than you ever did back when you could travel to see them. But also just acknowledging that things are very different and hard, and have been that way for a long time without much of a relief or a break. And we're still just not quite back to a return to normal, and we might never be back to things the way they were over a year ago. So I just really want to encourage people to be understanding of their employees. Additional resources. So I'll take you real quick to the Washington L&I COVID page and go through the different resources they have there. L&I small business, they don't have specific COVID help, but they do small business outreach. That's actually who has partnered with us to allow us to do these webinar series. Our educational page, I'll show you real quick. And then the roadmap to recovery, that's the page I already took you to from the governors. So I'm gonna real quick go to the L&I page and the EHSI page. And then we can do questions, and hopefully I just really want to hear about what other people's experiences have been. Okay, Sumaya, does it say labor and industries and coronavirus?
Yes, it does.
Perfect. I'm a little gun shy. We had a lot of issues my first webinar switching between screens. So it's everything for the state for COVID-19. They have employee trainings. They have a summary of all the requirements. They link back to that business guidance. That's the page I showed you before that gives the specific work plans for different types of industries. It gives you posters. This goes into different types of masks for different situations, up into and including respirators. They have the medical evaluation questionnaire, which is really important. If you have people wearing respirators, they need to be medically cleared. We'll go into this a lot in the next webinar, but they also have it in several different languages. Just a lot of really, really good resources. So get familiar with this page and get familiar with using the Labor and Industries website. They do have a lot of free templates. I know I've created a lot of accident prevention plans and site-specific safety plans using free resources that are available on this website. And then our web page is ehsintl.com/COVID-19 education. And we will very soon have blogs. I'm going to go into some different cool studies. I think I'm going to talk a bit more about variants. We'll also be posting each of our recorded webinars on this page. So I'm hoping people really share this information. We get some more people at our upcoming talks. And I think we should go into live Q&A. All right. I think we can wrap it up.